feel bad coming in and helping. I was trying to listen into her and going, man, I'm learning something here.
Still learning.
So I appreciate you guys having me come in and do this. This is something that the dangerous reptiles and invertebrates and stuff are something, even though I don't like spiders, it's weird. We deal with them all the time, and bugs just kind of give you the heebie-jeebies, but we have to deal with them all the time, and we work with them, and we're always helping people with studies. So. But reptiles are kind of my, I guess, hobby turned obsession. I have a whole ton of them. We do everything from breeding locally to assisting with studies, venom research, sending stuff off to labs. So we brought some animals in at the end. Once we're done, we'll go ahead and break some of them out, kind of show you some of the snakes that we have. One of the rattlesnakes that the rattlesnake that I brought, I only brought one, was one that was left over from a study that as he kind of grew up, he developed either, I don't know, an abscess or something going on with one of his glands, with one of his venom glands. But we'll open his mouth, you can see the fangs kind of retract and come back in. You'll see him try to bite down. Pretty cool to look at. First and foremost, things we're going to talk about, we're going to differentiate between poisonous and venomous. I know the basic class, I don't know if you guys have had this portion of the class, but I know you, in the medic class, you guys have, right? You guys have talked about some stings and bites, marine animals, jellyfish, stuff like that. We're going to discuss different types of venom, depending on what kind of enzymes are present in the venom, determine how it's going to react with the body. We're going to identify some venomous reptiles, venomous invertebrates, and we're going to talk about the treatment of some of these bites. So venomous or poisonous? When you think of snakes, lizards, spiders, scorpions, all that stuff, would you consider them venomous or poisonous?
Venomous.
Venomous, right? It's a term that's often used interchangeably, but there is actually a difference between the two. The delivery method distinguishes one from the other. So, poison is absorbed or ingested. Everybody's heard of poison dart frog, stuff like that? Everybody heard of poison dart frog? I don't want to assume that, but common, bright little teeny tiny frogs. In the wild, their skin, what's on their skin, the little layers on their skin, they're poisonous. You lick them, you can die. Same with a cane toad. In Australia, it's taken over Australia. Animals that eat them tend to get really sick or die, and so that's poison. Venom, on the other hand, is always injected. One way or another, it's injected, with the exception of, I hate to put always, and I should have just kind of put a question mark there, because we do have animals that spit their venom, like spitting cobras, and you can become envenomated that way too. But generally, it's injected. They inject toxins into the body, which is absorbed into the bloodstream. So, why are animals venomous? Two big reasons: predation and defense. So, you guys can see as far as predation, rapid immobilization of prey. A mouse and a lizard are a lot faster than a snake on the ground. They have to be able to bite them, subdue them within a reasonable amount of time so it can actually eat them. So rapid death, facilitation, prey relocation, and then accelerated digestion of prey. We'll talk about that in a sec, a little more. And then defense, predator recognition. If you see a snake, a rattlesnake, and he's standing up, you walk up on him and he's standing up. If he rattles, what are you going to do? You're going to stop, right? You're going to go, crap, probably shouldn't mess with that guy. He's dangerous. He's going to hurt me. Well, animals see the same thing. A snake rattles because they get too close, they stop. It's a defense mechanism and termination of an encounter. They have venom because if you're messing with them or another animal's trying to eat them or mess with them, I'm sitting here going like this to you, right? Messing with you, you're getting pissed off, you don't like it, telling me, geez, leave me alone. You have venom, you bite, causes extreme pain, you don't like it. You experienced that once, you think you're going to do it again, ever? No, probably not, right? So that's why. So types of venom. we have a neurotoxic venom. Consists of proteins that generally cause death by muscle paralysis. Primary role appears to be producing rapid prey death, especially prey that are resistant to venom. In mammals, these proteins are highly toxic. They have very low LD50 values. Do you guys remember LD50 from farm? Lethal dose, 50%. You guys remember that from farm? Med class? So basics, a lot of drugs, pretty much all drugs, right, have an LD50, and so does venom. LD50 is how much of a specific, so in this case, how much of this venom will it take to kill 50% of it? So the lower the LD50 value, the more toxic it is. They don't inflict a lot of pain. Generally, they're regarded as the most dangerous, but we'll talk about how that's being challenged right now. Types of venom, Mojave rattlesnakes, these are some examples. Coral snakes, black widows are all neurotoxic in nature. So symptoms, some pain at the bite site. Generally, it's not that widespread, horrible, oh my gosh, I think I'm gonna die pain, but in some animals it is. Muscle spasm, priapism, respiratory distress, arrest, incontinence, paralysis, ptosis. I'll show you guys a picture of what ptosis is right now in a sec. Hypertension is the most common, but as it progresses, hypotension they'll end up being hypotensive or have really low blood pressure. So some pics, this is ptosis right here. This is a normal picture right here as that neurotoxin kicks in and starts paralyzing the muscles. It'll cause them, they lose the ability to control their body. So any muscle, voluntary muscles, involuntary muscles, they lose that ability to control, well, their voluntary muscle. Involuntary just kind of dies out on its own. So this is a pretty good sign that they were bitten by something neurologic. Their eyelids will just start to droop. They can't control them. They can't keep them open. They can't lift them. So proteolytic venoms, this was termed, and I think in the text it's termed as hemotoxic or cytotoxic. That's a very vague term for what this type of venom does. So they call them proteolytic, and really what it does, they're just protein degrading enzymes. They just cause a raft of damage. They kill, it says right there, cytotoxic. So cyto, what's cyto mean, guys? Cell, toxic, not good. Hemo, what's hemo? Blood, right? Myo? Muscle, right? And then hemorrhagic activities. So several studies show right now there's a Loma Linda University, I don't know, do you guys remember that Venom ER show? I don't know, probably just me because I'm a weirdo and watch that crap, but Venom ER, there's this hospital in Southern California called Loma Linda Hospital, and a doctor named Sean Bush, really nice guy. He talks a lot about, and he's been very big on this study, the Southern Pacific rattlesnake in Southern California, ranges Southern California all the way up into some areas of Northern California. But side by side, they're showing that the Southern Pacific rattlesnake, based on its area, in certain areas is deadlier than the Mojave rattlesnake, which is what we have termed to be the most deadly snake, one of the most deadly snakes in the U.S., that and the coral snake. Most North American rattlesnakes, venomous snakes, either the rattlesnake, copperheads, cottonmouths, they are primarily proteolytic, which means they cause huge widespread damage to the vasculature, muscle. But in certain areas, and one of the snakes I'll show you guys right now, in its range, based on their range, their prey changes, where they live, their prey changes, and over time they've developed some neurotoxic venoms. So even the western diamondbacks that we see out here, in some areas, they have some neurotoxic effects. So beaded lizards, Gila monsters, primarily hemotoxic, they do have they're kind of a combined, and then recluse spiders. Everybody heard of brown recluse or recluse spider? So these are proteolytic bites. You can see this right here. There's some obvious swelling. Oh, this one has a pointer. Awesome. Sorry, first time using this. So you can see the obvious swelling there. That's probably pretty early on in the bite, within the first hour or so. Generally, You'll see a localized where the bite mark is, and then the swelling starts to take over after it. This is probably after a couple days here, that foot bite. You can see where the initial bite was right there. Right here, buddy, guy Bear Grylls. Everybody know who Bear Grylls is? Yeah, watch his show, Survivor Man. He's not Survivor Man, right? Man vs. Wild. Bear Grylls, pretty hardcore dude. This is one of his producers during a taping of his show. Was bitten in South America by, I believe, a fertilance, which is also this bite right here. This is a fertilance out of South America, Central South America. Up until recently, had a 100% mortality rate. You got bit, and to this day, without treatment, almost 100% mortality. You will probably die from that bite. This right here, not sure what this was to or what this bite was to, but these are pretty common. So all of them, except with the exception of this one, we tend to see like the skin kind of sloughing off right here, especially. This is post debridement, so they've already debrided that, they've already cleaned it up, the tissue's already died, and they've already made that pretty much clean for a photo op, apparently. But right here, this is where you get into some issue. What's this person doing right here? What does it look like is happening?
Skin necrosis.
So, pretty much being eaten from the inside out, right? That skin's dying, the tissue in there is dying, the muscles in there are dying. This person's probably going to have some really bad effects from that. And there's a good chance that they will die. I would venture to guess that they die from this. Or that person did die. Pretty nasty stuff, huh? Especially that one right there at the bottom. So, venom composition. This is the fun part for you guys, especially for the medics. There's about 20 different toxic enzymes found in venoms. They're common. There's debate as to whether or not there's some more. They're finding a lot of things happening right now with venom. And they're seeing some things in snakes that they haven't seen before. I don't know if it's an evolutionary thing or we're just seeing snakes evolve, or just stuff we haven't found because research has been going on with snakes since the 1800s, but we're really just starting to tip the iceberg on how we do research and whatnot. We're finding venom in a ton of things that we've never even thought, like bearded dragons. Anybody seen a bearded dragon at Petco? There's a study out right now that the guy challenges anybody to prove him wrong, but bearded dragons have a venom gland that's been kind of over time sealed over. It's still used to excrete some small amounts just for delivery. So when they bite you, anybody been bit by a snake? No, I'm the only one.
Like a bull snake or?
Bull snake, any kind of snake, yeah, any kind of snake. You bleed, right? You bleed quite a bit. Well, one, their teeth are like hypodermic needles, really teeny tiny needles. They have a whole crap load of them. The other thing is in their saliva, there's enzymes in there that are anticoagulants. So you continue to bleed and you continue to bleed, you continue to bleed. Like I guarantee that guy on the cover getting bit by that python, he bled like crazy and it sucked. I feel for him. I've been bit tons of times on the face, the neck, everywhere, and it sucks. It doesn't feel good. So enzymes are generally what, guys? For those of you guys in the medic class, particularly enzymes are almost always what? What kind? What?
Proteins.
Proteins, right? Almost always proteins. They're biological catalysts. So without changing the reaction, the overall reaction in the body, so it would normally happen that way. All they do is increase the effects. They cause crazy damage. So all they do is increase the rate of reaction. You take something, you get it wet, piece of metal, you get rid of its layer, you put it out in the sun. What's it going to do if it's wet? Metal.
Rust.
It's going to rust, right? And if it's wet, it's going to rust faster, right? In that sense, water acts as an oxidant. That's all this is doing. It just increases the reaction. It doesn't change the yield, change the equilibrium of the reaction. It just causes it to speed up. Makes it happen a lot quicker. So each specific enzyme has its own purpose. They're meant for a certain thing. And snakes generally have between 6 and 12 of those enzymes. just depending on what snake it is, determines what enzyme, or where that's, even the same snake in different areas. So you take a Mojave rattlesnake from southern Arizona, and you take the Mojave rattlesnake from southwest New Mexico, from the Otero Mesa, here in, well, Otero County, I guess. But you take those Mojave rattlesnakes, and you compare their venom, they are going to be different. They will have different enzymes. They do the same thing in the end, but the enzymes might be different. There might be one or two different, based on what it needs for that specific area. So some snakes have both neurotoxic and cytotoxic, proteolytic cytotoxic enzymes present. The snake that we have right here, its locality, the mountain range that it comes from, which is the Palencia Mountains in the Boot Hill, right by Rodeo, New Mexico, right along the Arizona border, middle of nowhere. From there west, they tend to have a high amount of neurotoxic in comparison to other areas that they occur. They cause a lot more damage. So, common enzymes. Everybody remember for the medics? You guys know what that is? Cholinesterase, right? What does cholinesterase do in the body generally? Acetylcholinesterase, cholinesterase, what does it generally do in the body?
It binds acetylcholine receptors.
What does it do to acetylcholine? It degrades it, right? It gets so guys in the basic class, if I'm talking a little over you, we'll explain it down. We'll explain it down. Anytime you do anything, right? Anytime you move, it's almost a, I hate to say pre-planned reaction, but it requires some things in the body, some electrical impulses, some, I hate to say stuff to be released, chemicals to be released. So what gets released? Presynapse, acetylcholine, right? And then postsynapse is the, oh, do you mind?
Yeah.
Awesome. So who would have known there were dry erase markers in a classroom with a dry erase board? So I'm probably going to screw this drawing up, but, so, right? This is presynaptic, horrible drawing. I should have Chris just come in. I'll explain it and have him draw for me. So acetylcholine is released right here, right? On this side, depending on what type of response we're going to get, determines what's going to be released, right? If it's fight or flight, your parasympathetic or your sympathetic nervous system, what's going to be released? Norepi, right? Norepinephrine. And that causes what?
The fight-or-flight response.
Fight-or-flight response, right? Okay. And then your parasympathetic nervous system, we'll assume that this is the same. What's released here? What's here? Acetylcholine again, right? What's here? Acetylcholine. All right? So acetylcholine's released. In order for that impulse to stop, what comes in and keeps this from, and breaks it down? Cholinesterase. That's a pretty easy way of, I guarantee you, it probably wasn't so eloquently put as it was during your guys' initial class, but I sat through the same class, and it's amazing listening to Chris talk about that stuff, because, man, it really helps you get it. I told you guys before, you guys are probably further along than I am when it comes to that stuff. But at that level, that's pretty much basically how it happened. So when you want your fight or flight, when your fight or flight response kicks in, something happens that makes your heart rate increase, all that, this is what's happening. Acetylcholine's released here, norepinephrine, and then postsynapse, after that synaptic gap, is norepinephrine. Norepinephrine's released that causes your heart rate to increase, causes your pupils to dilate, all that stuff. Right? Dilate? No. Constrict. Dilate. Yeah, dilate. Acetylcholine, and then your feeder breed, parasympathetic nervous system, acetylcholine's released. Acetylcholine is on the other side too, the other side of that gap. And cholinesterase is what breaks that down and stops that impulse from happening. What happens in snakes is cholinesterase stays here and stays here, and it just keeps hitting and hitting and hitting and hitting and hitting and hitting. And what happens? Those muscles keep muscle spasms, right? cause muscle spasms, really bad muscle spasms. What do you think is going to happen? What happens when the heart beats too much, too fast?
Oh, it's eventually gonna stop.
What happens to muscle when it works up too much? It tires. And that's what we're seeing with neurotoxic venoms. A lot of neurotoxic venoms is, and that's where you see cholinesterase is in neurotoxic venoms, primarily in neurotoxic snakes. They just work and work and work. They work that synapse so much that the muscle just tires, relaxes, and is unable to do anything. It paralyzes the muscle. That's why you see people not breathing, respiratory arrest, stuff like that. And then you see proteases. They catalyze reactions, disrupt protein peptide bonds. They cause blood vessel wall damage, hemorrhage, muscle fiber deterioration, and they're found in proteolytic snakes. Naturally, protease is proteolytic. Another thing that these tend to cause is a release of ATP. You guys remember ATP? Adenosine, what? Triphosphate. And it causes a profound, it just causes the body to dump ATP. And when the body dumps ATP, it causes profound vasodilation, and that's why you see hypotensive patients in your proteolytic bites. That's what's going to cause them to be hypotensive is the vasodilation from the dump of ATP. There's a bunch of other things. But I thought it was awesome that cholinesterase was present in those venoms. And the way it binds is pretty cool. So, deadly snakes of the U.S. Rattlesnakes, 20 different species. New Mexico has 10 of those 20. A couple possibles. There's been some found on the New Mexico side, but they're not quite ready to call them native snakes to New Mexico, which is weird. Most common you see are probably prairie rattlesnakes and western diamondbacks. And the reason that is because most other snakes are either they sit in mountains, they're in foothills, they are generally where people aren't. These ones here, seems like they're everywhere. They're like roaches. You drive down a road at night and you're going to see these in the summertime or August, September time. You're going to see them like crazy. They're everywhere. The deadliest, still considered a hobby. It occurs in the Boot Hill area and on the Otero Mesa along the Texas border. So the Boot Hill is Animas, New Mexico, pretty much Animas, New Mexico west. That area along Highway 9. I don't know if anybody's familiar with that spot. It's the middle of nowhere, so if you're not, you're not missing anything. It's pretty much just mountains and border patrol. But it occurs there, and they're pretty common there. I mean, you drive down the road and you see Mojaves just as much as you see anything else. You see more Mojaves than cows. But 20 different species. Who would have thought there's that many different species of rattlesnakes, and they're so variable, and I mean, they occur at pretty much everywhere. Every state in the U.S. except Alaska has native rattlesnakes. So these are some that are found here. Well, I was curious, how do those pictures look? I was curious to see how those pictures would look on TV or on the screen. They look good on a computer when I stretch them out to make them fit. Right here, anybody know what that one is?
Western Diamondback.
Western Diamondback. How can you tell?
The black and white tail.
Black and white bands, thick black and white bands on the tail, right? This is your common snake. This is what everybody sees. This is the icon of the American Southwest, right? Huge, big snake. Anybody ever seen some really huge ones? 4, 5 footers, 6 footers. I swear those like 3.5 footers. Sometimes we get calls to remove them. And we got called the other day for a lady who was like, I have a snake. It's caught in some chicken wire at my house. By my garden, they put chicken wire behind a mountain. They put chicken wire around all their plants to keep rabbits from eating them, rabbits and deer. Well, one of these snakes decided it was going to go through the chicken wire about halfway through. Got stuck, couldn't get back out. So they called us out there, and she was like, it's like 7 feet long. And we get there, it's like, I don't know, 2.5 feet. I was like, oh,
They always look bigger than
that's a
they really
huge
are.
7 feet. That's huge. So this bottom one right here is your second most common one. What's it lacking? Doesn't have black and white bands, right? Doesn't have those black and white bands. But to the common person, they may look exactly the same, but similar types of venom. They pretty much do all the same thing. I can tell you right now, having been bit by one of these, they bite hard and they're mean as hell. They're not one to mess with.
Is
Rabbit
that a timber rattler?
Huh?
Is that a timber rattler?
next to it.
No, the one you're pointing at.
Oh no, that's a prairie rattlesnake.
Okay.
Yeah, that one's a prairie rattlesnake. They're just mean. They're little bastards. I hate to say it, but they're you get near them, and the minute they're agitated, they're not like Western Diamondbacks. Western Diamondbacks typically will stand their ground. I mean, they're not afraid of you. They're going to stand there and they're going to rattle their tail. They're going to tell you, look, you get any closer, and this is an old one. He's salty. You can see that rattle. But they're going to bite you. If you don't leave them alone, they're going to bite you. Snakes can strike about 2/3 of their body length. So you get a 6-foot snake, 4 foot away, he's tagging you. And a rattlesnake, the Western Diamondback bite strikes generally in about 1/100th of a second. So I don't want to be on the losing end of that battle. We do everything with hooks generally. Anytime we do any removing, we use hooks, we use tubes, we use everything we can to keep those heads away from us. There's a buddy of mine who does some stuff every so often. He did that like I Was Bit on Animal Planet. He's a guy he's a researcher out of Alpine, Texas, and he was bit on the hand, showing a bunch of students like, hey guys, check this out. This is a rattlesnake. Picks it up and it turns around. It's a Western Diamondback. Bit him on the hand and he lost most of the use of his finger. Had to have the bones fused together to keep him from losing them. They were pretty much just fused together. Everything was fused, and so now when he shakes your hand, it's weird. It's like that. Use my strong hand. And it's awkward. It's that like awkward like, should I not? Am I gonna be grossed out? And to this day, we make fun of him. This one right here, prairie rattlesnake, they pack a really bad bite. They're a lot smaller than the Western Diamondback, generally 2.5 to 4-ish feet, 3 foot is a good average, 2.5 to 3 foot is a good average for them. They're just mean. They will flip the opposite way to try to bite you. Right here, this is one in New Mexico that everybody calls a timber rattlesnake. People refer to it like, I saw a timber rattlesnake, and they look very similar to timber rattlesnakes. It's called a black-tailed rattlesnake. Why do you think they call it a black-tailed rattlesnake? It's got a black tail, right? And they're pretty variable. They range anywhere from like an olive green color, gray color, to a bright, bright yellow. Really cool snakes. They're generally really cool. They don't rattle. It's really hard to get them to rattle. You have to kind of like piss them off, like chunk rocks in their area, or do whatever you can to try to get them to rattle. They're generally really calm and relaxed. You see a lot of people who probably aren't the smartest. They have probably a couple screws missing. That they try to pick these up and handle them. I don't know, man. It's like freaking Russian roulette, You don't want to get bit by one of those. They pack a really nasty bite too. These are my favorite, and this is one of the ones that I brought for you guys to see today. I'm saving this one for last, so if you guys are wondering why I skipped that one. But this one right here, it's called a banded rock rattlesnake. They occur all over New Mexico, pretty much from Socorro down. The Oregon's is probably their furthest eastern range, but everywhere west of the Oregon Mountains and south of Socorro, they occur. They're in every mountain range. You find a rock pile, those like rock slide looking things. You find those, I guarantee they're in there. There's tons of them. You just don't see them that often. They're not real common. This is one of the ones that we have that was being used for a study. This one right here, this is your, I don't know, crap. I was worried about that. Yeah, that shadow's terrible. I don't know, can you guys see that tail at all? Yeah. Probably not, yeah? I can barely see it, I'm blind. But the tail, they have black and white bands as well. They're just not as pronounced. They're really thin black and white. The white and black aren't so, like you can tell these are pretty, the white's a little bigger, but pretty close to being the same. These ones here, are teeny tiny white bands and a lot more white. That's your Mojave rattlesnake. It's what's considered to be the deadliest snake in the U.S. right now, by most standards. And mainly because it's neurotoxic in nature, because, respiratory arrest. So this one right here is New Mexico's pride and joy. It only occurs in New Mexico, small sliver in Arizona, and in Mexico it occurs. But in New Mexico, it occurs in the Palencia Mountains. It's called the New Mexico ridge-nosed rattlesnake. Highly protected. You walk over there, you walk up a canyon, and you have U.S. Fish and Wildlife kind of peeking down at you like, oh, what are you touching? They're really protective of these because some of them made it into captive populations. Early 2000s, And they shouldn't have. That's the best way to put it without sounding like I think somebody went out and caught them and put them in their private collection and said they got them from Mexico. So, more deadly snakes, copperheads and cottonmouths. They're all part of the pit viper family, which pit vipers have that diamond-shaped head. Normally their head is really weird. Their neck is a lot thinner. It doesn't flow smooth, I guess is the best way to put it. They have this really big head. Oh gosh, that whole, I can't even, that's terrible. You know, big diamond-shaped head. And then their neck kind of just comes in. That's a little better. This right here normally looks like little nodules on the back of their head. What do you think that is? Why do you think they have those? What do you think is stored in here? Well, their teeth are stored like right here, and they kind of, in rattlesnakes, they fold up. And I'll show you guys actually with one of the rattlesnakes how the teeth kind of fold up and come in and out whenever they want. Right here is where all their venom is stored. That's why they have those huge bulges on the back. Most vipers do. So depending on the snake determines how much venom yield it has. Vipers, rattlesnakes, stuff like that, they tend to have a huge venom yield. So same look minus the rattle. They look like rattlesnakes. They just don't have a rattle on them. In New Mexico, you will never, ever, 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 ever see one of these in the wild. I say that in the wild because I guarantee there's probably multiple people in the city alone that keep them. So there's multiple subspecies of each across the U.S. And they generally occur pretty much from the Trans-Pecos area in Texas east. Along the southern part, copperheads and cottonmouths, they go all the way up into like the Pennsylvania area along that eastern seaboard. Coral snakes, they're not pit vipers. They belong to a family called the elapids, more closely related to cobras. They're the only elapid in the U.S., true elapid in the U.S., and they have fangs in the front part of their mouth too. The only difference between a viper and a coral snake is vipers can take their fangs and fold them up. They fold them in and out. You guys have seen the bite pictures where a snake's biting and the teeth are popped out like crazy. It's because they bring them out. Coral snakes and elapids, they have fixed fangs. The fangs sit there and they're there. They don't move. They don't really articulate. They don't really do anything. The most neurotoxic snake in the U.S., the problem is they have a really low venom yield. They're tiny little things, teeny tiny. Small venom yield, and it's hard for them to actually get a bite. They have to actually like get on you and chew. You really got to be a dummy to get bit by one of these. Nobody's been bit, right? No? Okay.
Those have a more circular pattern than that, right?
A what?
The circular teeth pattern.
No, these, I mean, they have two actual fangs. They're just really small, so even when you open their mouth, you can't really see them. It really requires for them to push down or for you to manipulate their mouth for you to see the fangs. They're there. And rattlesnakes, they have that like curved, they'll have that curved. And these ones here are, they're somewhat curved, but they're fixed in place. Most other teeth in snakes are somewhat movable. They move a little. The reclusive species, they're generally only come out at night. They spend most of their time underground, hunting, eating stuff underground. 3 different subspecies in the U.S. So we have the Texas coral, the eastern coral, and the western coral, or Arizona coral. So right here, this is a copperhead. These two right here, top and bottom, are copperheads. Look similar to rattlesnakes, right? Just no rattle. No rattle on the end, nothing to let you know that they're there. So, cottonmouth, they're also referred to as water moccasins, same thing. You can see its fangs. See the fangs right there? They're kind of poking out. Why do they call them cottonmouths? They have white mouths, and that's pretty typical of them. You get within 2-3 feet of them, and that's what they're doing, and then they start striking, and it seems like they're chasing you. They're mean as hell. But they have really white mouths. It's weird. You look at them, and they open it, and they let you know that it's there. They're real big. So right here, this is your eastern coral snake, pretty ugly drab. You can see, and then up here is the western coral snake, which, I don't know, don't they always say, like, what's the little term that they use for venomous snakes? Red to black, friend of Jack, or venom black, or whatever, or red to yellow,
Kill a fellow.
kill a fellow. Does that look yellow? It's pretty white, right? So, just remember, if red touches anything other than black in the U.S., you probably don't want to be anywhere near it, because this looks a lot like some of the milk snakes and king snakes that we have in the U.S., here in the U.S., but in no instance does red touch the white or yellow, ever. And they're small, these things are teeny tiny, so, I mean, foot and a half, 2 foot, the most, generally. They primarily eat lizards. You rarely see them feeding on rodents. That's why they have a neurotoxic venom, because lizards do pretty good against like hemotoxic type venoms. Lizards, they just, for some odd reason, they're not really affected by it. So potent neurotoxins are really what's needed, something to paralyze them and keep them from moving, keep them from breathing. Treatment of snake bites. The fun part, right guys? This is all pretty basic. There's not much we can do for snake bites. So we're going to keep the patient calm. Monitor what? ABCs. O2 IV monitor. So if somebody's normal tensive generally, if we have what we would consider a normal tensive patient, they're, you take a look at them, you're like, oh, this guy's not that sick. It's just in a lot of pain. And if he's been bit by a snake, why do you still have to monitor vitals every 5 minutes?
If it's a slow onset.
They deteriorate really quick. These people will, I mean, they can deteriorate really quick, especially in neurotoxic venom. They can go from talking to you just fine to apneic fairly quick, within minutes. I don't want to say quick like quick, but quick enough. You want to monitor, you're going to do cardiac monitoring for the medics. You're going to do cardiac monitoring. You want to monitor everything that's going on with them. You're going to mobilize the arm. We talked about it last time. Somebody, I think you had mentioned it, right? Keep the arm at the level of the heart or above, at or above the level of the heart. Wherever they're bit, you want to keep it at or above the level of the heart. It's going to be hard if it's their foot or ankle. But why is that?
So
Just
slow.
slows the spread.
Just slows the spreading. You're going to keep it with sterile dressing. Evaluate PMS. You want to make sure they still have good PMS distally. You're going to draw. This is really, really important. And people, a lot of times, don't do this. And this is really important. It allows, if you have a doc who kind of knows what he's doing, it allows him to track the spread and how quick it's attacking this guy. In the ER, did you guys ever, they draw around it pretty much, right? And keep drawing. So pre-hospital, I think in the hospital they do every 30 minutes to an hour to track it. But pre-hospital, every 15 minutes, you should be drawing around the area, around the swelling. Wherever that swelling is gone, you just, I mean, even if it's like some weird, odd looking line, even if it's like, whoa, all the way, and it comes back in and the bite mark's right here, you really want to track it. You want to write the time and the time you did it. It's really important. I find a way to mess all that up. Constricting bands above and below, if required per protocol. The state scope requires you to put constricting bands, I think it's 5 inches above, 5 inches below, to reduce lymphatic flow. It's highly controversial. I can tell you, if you take a patient, you bring a patient here, I don't know how well the doctors are, how well versed they are in snake bites, but if you take a patient to UNM with this bite and you have constricting bands on, you're probably going to get your, reamed. The doc, one of the EDR up there is pretty good at treating snake bites. They do not want to see this. What does that do?
Cuts off circulation.
Where does it keep the venom?
In the area.
So what's the problem if you have a proteolytic or hemotoxic, cytotoxic venom and you're keeping it in that area?
You're going to release the venom as soon as you...
It's acting in that area and it's degrading tissue. Generally, snakes in the U.S., I don't want to say they're not dangerous. They are dangerous, but most people don't die in the first 16 hours. They get sick. They get sick as crap. If you're going to die, you're probably going to die within that 18 to 36 hour range. And generally, you have time. You have some time. Not saying it's not serious. I 100% believe it. Probably because I like snakes and that it's probably a rapid transport to the hospital. Even if they're stable, you just want to get them there. It's on another slide, I'm sure, but don't apply ice packs, ice or cold packs for the same reason. You're gonna keep everything there, and you're really gonna cause damage to that area. A whole ton of damage to that area. You're gonna pretty much give that guy a good chance at losing that limb or that arm, when most times they're fine. Don't take the snake with you. Don't take it. There's no need to. In the United States, there's only one antivenom for all pit vipers that's approved, and that's Crofab. There's another one that's working its way in. It's a heck of a lot cheaper and works a lot better. It's primarily used for rattlesnakes out of Mexico, Central and South America. And I wish I knew the name, but I don't off the top of my head. But it's not approved here, and you're not going to get it. The only way you're going to get it is if there's a Crofab shortage. But Crofab is what they use in the U.S., and it's pretty expensive. $1,000 a vial, right around, something like that. You guys in the ER car, you guys use Crofab ever? Yeah. You know when people are using Crofab in the ER because you see them, you'll have multiple people sitting there with vials going like this, just going like this and rubbing them in between their hands, and that's what they're doing. That's Crofab. It's required that you do that. But say decent antivenom, generally 5-10 vials. I don't know, what's the standard at MMC? No standard, you just keep giving it as needed? Oh, you don't know? Okay. Chris, you guys?
They generally have a protocol that you follow, the signs and symptoms, and based on the signs and symptoms, they get so many vials, and you load them with that.
Signs, lab values, stuff like that. Okay. I've been on a couple bites, generally people who keep a lot of snakes, and that's the other thing I was going to talk about. If it's their own personal snake, and they tell you I was bit by this, I'm pretty sure they know what, take their word for it, especially if they're keepers. A lot of people keep animals in New Mexico. It's in Las Cruces. They shouldn't be because of codes unless you have permits, but people do have them. When we still do kind of have like a reptile rescue type thing. And people will call us, and that Fer-de-Lance, the one that deteriorated that guy's leg, I had one of those like 3 years ago that I was calling Game and Fish going, please get this out of here. I don't want this thing. It's going to bite me. We've had people call for that. We've had spitting cobras come through, gaboon vipers, which have 2-inch fangs. They're huge. You can't do anything with them because if you try to pin them down, there's a way to do it, but for people who aren't really experienced with those type of snakes, those fangs, they'll push them right through the back of their head to try to bite you or try to get you. They're really crappy snakes to deal with it, and people have them here. It's ignorance if you think you're not going to come across that stuff. There's alligators here. All that crap is here. It's in the city. People have it. So take their word for it. Generally, hospitals only keep Crofab. They don't keep any other kind of antivenom here. Not even the coral snake antivenom. They don't keep it. There's a huge shortage, so it's reserved for only emergencies. 2 lizards are considered venomous. We talked about the bearded dragon a little. They're finding venom glands. They're finding venom glands and all kinds of stuff. Monitor lizards, but they're really only seeing some of those like anticoagulant type ones. Those enzymes in it. They're not really seeing anything crazy. Both lizards have neuro and proteolytic enzymes present in their venom. They cause the same damage as some of the rattlesnakes. The Gila Monster occurs in the desert southwest from California to New Mexico, up into Nevada and Utah, and that's about it. Only venomous lizard in the U.S. that's recognized in the U.S. Venom is being studied right now for use with type 2 diabetes. It's a very, very big study going on right now. And they're seeing some really positive effects in using this venom for type 2 diabetes, or using parts of the venom to treat type 2 diabetes and develop medications. Beaded lizards range from northern Central America to northern Mexico. There are no records in the U.S. for accounts in the wild. treatments, and then treatments are similar to snake bites. So on the left here, on your guys' left, is a Gila Monster, typical, orange, black. They occur in New Mexico. They occur pretty much west of Animus. There is one record. Anybody know where Kilbourne Hole is here? There's one record from Kilbourne Hole about 60 years ago. And I think that animal is still at NMSU. The state herpetologist, Charlie Painter, and a couple other herpetologists out of UNM and Albuquerque area have kind of discounted that and said they're guessing, they think it was a released one. I've also seen pictures of like old black and white pictures in people's yards when, driving, there was no need to drive that far. People normally didn't travel like that, of Gila monsters. And this is up in the Butterfield area off Highway 70. So I don't know. I can't tell you whether or not it's true or not. I can tell you I've never seen one, and there are no true verifiable records of wild populations existing this far east. And then the beaded lizard, they're a lot bigger. I mean, some of these ones, they get huge. The real fuerte ones, they get 3.5, 4 feet long. They're monstrous. These things tend to stay really small, right around 12 inches, 13 inches. Any questions so far, guys? Am I going too fast for anybody? I warned the medic class that I get on a roll and I'm going to start going quick. It's going to get quicker and quicker. But if you guys have any questions, stop me, please, because I'll keep going. Anybody need a break? Potty? No? Sure. 45 minutes in. Get it while you got it. No? Dangerous spiders. So all spiders are venomous. Not poisonous, right? Venomous. They're either not very strong or lack the mechanism for breaking the skin. They lack the mechanism. And that's that's probably the biggest one. Because as a spider, you would think probably required that you have a pretty strong venom, right? They really need to do some damage pretty quick. They just don't have the mechanism. Daddy longlegs, you hear all those studies or people talking about daddy longlegs are the most venomous spider in the world. They just can't bite people. Who knows? I don't know. I've read the same things that you guys, and I've heard the same things as you guys. I do my best to stay away from spiders, so. Right now in the U.S., there's 3 spiders that are considered dangerous and have potentially deadly bites. Black widow, everybody knows, right? Everybody seen a black widow before? The recluse spider, everybody seen a recluse or heard of it? And then the hobo spider. A lot of people haven't heard of the hobo spider. It's out of the Pacific Northwest. Anybody from like the Washington area, Oregon? Anybody from up there? No? That's where that's where they're seeing a lot of that one. And they pack a pretty good bite too. So the black widow ranges across the world. It's found in every state in the U.S. except Alaska, I believe. Potent neurotoxic venom causes extreme pain and muscle spasms. You'll see people doubled over. I mean, you will think they're about to die because of the pain and spasms. We had one of the guys I work with. He's a lieutenant. He was bit by a black widow, and he said he was doubled over in the hospital, and they were giving him every painkiller known to man. They were giving him benzos, painkiller. They were giving him morphine, benzos, everything just to keep him comfortable. Really, really bad. I don't know if anybody's ever. Have you ever treated anybody bit by a black widow, Chris?
I don't think so.
You have? Pretty bad? A lot of pain?
Yeah, it was a young kid, but yeah, it seemed.
Pretty out of it?
Yeah.
Pretty. It causes a lot of pain. I can say I've never been bit by one of them, and I'm glad because it sounds like it sucks. Everybody I've talked to that says they've been bit says it sucks. May cause local swelling or redness. You're not going to have that big pull, pussy ulcerations. You're not going to have any of that with these bites. You're going to pretty much see two teeth marks, maybe a little swelling, some redness around the area from the bite specifically, not from the venom. They have a very specific antivenom for it, and it has a high allergy rate. 3 to 4 people a year are killed just from the antivenom. So they normally don't give it unless it's truly needed. And the bite is normally felt. They're going to tell you, I reached in and felt a bite. I felt something bite me. It's normally felt. They have really big fangs. They bite hard. So black widow treatment, immobilize the bite area and keep the site clean. Naturally, right? Keep it at or above the level of the heart. ABCs, vitals, O2 as needed, and an IV. They're going to need painkillers. For the medics, They're gonna need painkillers, they're probably gonna get benzos to prevent spasms, to prevent all that other junk from happening. But painkillers are probably gonna be a really big one. They're gonna need some pain management. And right here, guys, this is outside of the basic scope of practice, so you guys don't worry about that part, okay? But what's this right here? For protocol, you guys are gonna have to get calcium chloride, calcium gluconate, and that is to treat the spasms. That's to treat the spasms. How do you think that treats the spasms?
Must be a calcium channel blockers.
It says here,
Calcium.
it says it pretty inactive calcium channel opening, that's what the black widow does, it opens all your calcium channels.
Okay.
But I don't understand why, because calcium doesn't usually contract your muscles.
Does it drain your calcium levels, or, I mean,
So it opens them presynaptic, right? So what normally causes a cell to contract? A muscle to contract? Calcium doing what? Going in or leaving?
going,
Sarcoplasm.
Going in, right?
yes.
What leaves as calcium comes in?
Sodium.
Potassium.
Potassium, right, Chris? Getting this right? Okay. So I'm double checking because you guys have some looks on your face, and I know you guys just learned this. So my understanding of it, it just keeps calcium from being able to leave the cell and flushing out. I don't believe me. I sat and I was like, they're gonna freaking ask me, and I sat. This is probably where I spent most of my time going. Man, I need to know how exactly how this works, and I can tell you that I don't. My guess is that you're adding calcium, and it's preventing calcium from flushing out. Chris? No
I got
clue?
nothing.
No? Okay. Oh,
I'll defer.
okay. And I can tell you this. Preparing this, I prepared this last night. Preparing this has really made me think like, man, I need to research this because I can tell you that. Yeah, I couldn't tell you. I exactly where it works or how it works, I have no idea. I just know that that's the treatment, it's the standard. And I hate to say that, I feel bad that I don't know that, but it's better than me blowing something up your guys' butt, right?
I'm just going off of, because you usually give, I mean, I know it's for smooth muscle, so you give magnesium for any muscle, for muscle relaxation and stuff. But here it says that, I mean, it opens the sodium or the calcium channels, and then it's the release of multiple vasoactive and myoactive neurotransmitters. And it says you'll have muscle cramping, hypertension, all that stuff. But how does calcium relax your muscles?
Does it have to do with the potassium? Do you use it for?
Unless
you
Anybody want to?
We'll have to look over it over lunch.
We will.
I feel like that's our next project.
But I can tell you that calcium is the standard. And I wish I had your guys' book. I don't have your guys' book, but I was even looking through my old book, and I was like, crap. Going through every page, every section to try to find exactly where and why and how. Because I had the same questions. I was like, well, excessive calcium would probably, I don't know if you're trying to make them hypercalcemic, but I don't think so. But I think hypercalcemic patients have muscle spasms. So, I don't know. You guys' guess is as good as mine right now. We'll look it up and I'll get an answer for you guys. Recluse spider. So there's multiple species across the U.S. The brown recluse is native to the southeast U.S. but has been found outside of its area, most likely due to commercial transportation. So their native area for the specific brown recluse, there's tons of subspecies, but for the brown recluse, doesn't generally occur west of Dallas, Texas. But, so the desert southwest is home to a recluse spider though. It's home to the Apachean recluse, specifically in Las Cruces, and the desert recluse has some, in Arizona has some they have some overlapping boundaries. Venom is a potent, it's considered a dermonecrotic venom. Some people call it cytotoxic, hemotoxic, but the necrosis is generally at the site of the bite or around the bite. So they call it a dermonecrotic venom. It causes severe necrosis, bleeding, renal failure, naturally, right? amongst other things. I put etc. But you know, it's gonna damage tissue. It's gonna damage the vascular wall. It's gonna damage muscle. It's gonna everything. Skin. It's gonna eat through everything. So that is a recluse spider, a brown recluse on the left, and on the right is the Apache recluse, which is the one that you would generally find here. They both have. Did you guys see the little fiddle right there? That's what the fiddleback comes from. That's what that. A lot of people look for it on the butt, but it's right there. You see it? It looks like a little violin on its back. That's what that is. Really nasty bite, guys. Really, really nasty bite. So geographic range. So there's the desert, the Arizona recluse, the Apache recluse. I don't know those two. And then the big recluse is the brown recluse. I don't know what the common name for those two are. But every one of them can produce the same type of bite, extremely necrotic bites. So there you go. There's some bites. You can see these have already been debrided. These are probably even post-op. So that is where they grafted it. So hopefully it grows back and looks nice. You can see some of those, and you can still see like the webbing where it looks like in the scar after some people have been bit. Pretty nasty bites from those things. And you generally don't feel that bite. It's a reactive bite. It's not a. So you can put a brown recluse on your hand, and he can't bite you. He's not able to bite you. He's not able to penetrate the skin. What's required is that you push on him. If you push, that's why generally people get bit putting on their shoes, putting on gloves, putting on clothes. The back pressure allows him to bite you. So, something I learned doing some more research over this weekend. So, I always was like, they'll bite you, don't touch them. They'll bite you. So you see guys in videos putting them on their arms and stuff like that, and they're like, as long as you don't push on them or do anything to create any kind of pressure against your skin, they can't pierce the skin. Thought that was pretty crazy. So hobo spider, Pacific Northwest, much larger than a recluse, bite similar to a recluse spider. They can't bite you on their own. There was a study that was talking about how bad these bites are. And what they did was they shaved the backs of rabbits. I know it sounds nasty, but it was a zoologist up in Washington at the Seattle Zoo. They shaved the backs of rabbits because there were some people going, that thing's not dead. That thing's not dangerous. Don't worry about it. They would have to put the spider on the rabbit's back and then push down on the spider so it could actually pierce the skin and bite them. The same thing. The difference between these and recluses are generally real shy. They stay away. I think they were saying that within somebody's house, there's an average of like 30 to 50 recluse spiders in the area. Within, like, either inside the house, the attic, or right around within feet of the house, either way. Pretty nasty. But these guys will attack you. They will come after you, trying to bite you. They don't break the skin, but they are very aggressive spiders. So people probably get bit by these pretty regularly. Recluse and hobo spider bite treatment. Immobilize your extremity above. Rat level of heart, swollen area, write the time. Circle the swollen area, write the time. Every 15 minutes. Why didn't I put that for the black widow?
It doesn't really spread like that. It stays into the tiny bite.
You're not expecting it to spread. You shouldn't see any swelling with those bites. So if you want to be safe, if they don't have the spider there, then what do? You circle it, and you're probably not going to have any swelling. Wrap with sterile dressing and place cold pack over the bite site. What did I say with snakes that you don't do?
Don't place the cold pack.
You don't, but with the standard of care for this type of bite, for these dermonecrotic bites, are to put ice packs over it. Because when they're warm, it accelerates the tissue destruction. I don't know if it's specific enzymes in there that react to cold, that when they're colder, they just slow down, they stop moving, they don't work. But in this crazy instance, if somebody happens to get bit by a recluse or a hobo spider, and you know that's what it is, put a cold pack. If there's any chance it could be a snake, please don't put a cold pack. So monitor ABCs, vitals every 5 minutes. IV. Try and take the spider with you if available. So we don't do that with snakes, but with spiders, Scorpions, anything like that, try to take them with you if you can, if it's captured or whatnot. Transport to the appropriate facility. Most hospitals can manage the initial bite. Patient may need to be transferred out or whatnot for skin grafts or whatnot, but I don't know if they do grafts here locally. No clue. Anyway,
Do you wanna take a break before we move on, or
we can.
about an hour, give them maybe 10 minutes?
Perfect.